All right, in this explainer, we're going to crack open the science behind one of the most game-changing medications of the 20th century, fluoxetine.
Yep, you know it as Prozac, a name that didn't just appear on pharmacy shelves, it became a household word and completely changed the way we talk about mental health.
So, how does this thing actually work? Behind that famous little green and white capsule is a really fascinating story of brain chemistry and medical innovation. Let's dive in.
To really get why this was such a big deal, you have to picture what things were like before it came along. Its arrival wasn't just an improvement, it was a full-blown revolution.
Fluoxetine was the pioneer here, the very first of a brand new class of drugs called SSRIs, and the key word there is selective. Its genius was in its precision. It was designed to target one specific chemical messenger in the brain. See, before Prozac hit the scene, the antidepressants that were out there, well, they came with a whole laundry list of pretty rough side effects. This new drug was so much safer, so much easier for people to tolerate. It really opened the door to effective treatment for millions. It was a whole new ballgame. So how does it actually pull this off? How does it get in there and, rewire the communication network that's running our brains? Let's get into the nitty-gritty. So the star of our show is a chemical called serotonin. Think of it like the brain's thermostat for your mood, sleep, and anxiety. The whole idea is that in conditions like depression, the signaling from this crucial chemical gets a little out of whack.
Okay, this male analogy is just perfect for explaining this complex process. So imagine your brain cells are sending letters to each other. One cell sends out serotonin. That's the letter. It drops it into the gap between cells, the synapse, which is kind of like the mailbox. The next cell reads the letter. Now, normally a little mail carrier comes by to clean up or reabsorb any leftover letters. But here's the trick. Fluoxetine steps in and basically tells that mail carrier to take a break. It blocks it. So what happens? More of those serotonin letters hang around in the mailbox for longer, making the message stronger and louder. Pretty clever, right?
And here's what's so cool, because serotonin isn't just about mood. It's involved in all sorts of things in the brain. That made fluoxetine this incredible, versatile medical tool. Okay, so of course, the big one is for major depressive disorder. But that's just the start. It's also a powerhouse for OCD, helping to quiet those intrusive, looping thoughts. It's used for bulimia to help reduce binge-purge cycles, and for panic disorder to help stop those sudden, overwhelming attacks of fear. It's even approved for PMDD, which is a really severe form of PMS. And get this, its use doesn't even stop there. Doctors also prescribe it off-label. That means it's used for conditions it wasn't officially approved for, but has been shown to work, like post-traumatic stress disorder and generalized anxiety. All right, so once this little pill is in your system, it starts a really unique and kind of surprisingly long journey through your body.
Okay, get ready for this number. 7 to 15 days. That's the half-life of its active component. A half-life is how long it takes for half the drug to leave your system. To put that in perspective, that is incredibly long for a medication. Most drugs are in and out in a day or two.
So what does this actually mean for a patient? Well, it's kind of a good news, bad news situation. On the plus side, if you happen to miss a dose, it's not a disaster. You probably won't feel any immediate harsh withdrawal. But the flip side is, it takes a long time for the drug to build up to the right level in your system, and it takes just as long to clear out if you decide to stop. Which brings us to a really important conversation we have to have with any medicine, weighing the incredible benefits against the real-world risks. Look, like any drug that actually works, there can be side effects. A lot of people might feel things like nausea, headaches, or have trouble sleeping when they first start out. That's usually just the body getting used to it. And yeah, sexual side effects are a well-known issue for this entire class of SSRIs. Now, we have to talk about the most serious warning. It's called a black box warning from the FDA, and it's on all antidepressants. It says that for younger people, so children, adolescents, and young adults up to about 25, there can be, paradoxically, an increased risk of suicidal thoughts, especially right at the beginning of treatment. This is exactly why it is so critical to be under a doctor's close watch.
And there are a couple of other serious, though pretty rare, things to know about. There's something called serotonin syndrome, which can happen if serotonin levels get dangerously high, usually from mixing meds. And because of the way your liver processes it, fluoxetine can interfere with a ton of other drugs. The bottom line here is simple. This is powerful stuff, and it absolutely has to be managed by a medical professional.
So there's just no question about it. Fluoxetine was a total game changer. It helped prove the serotonin theory of depression and gave millions of people a safer path to feeling better. It blew open a whole new chapter in mental health care. And it really makes you wonder, right? As we learn more and more about the incredible complexity of the brain, what's the next revolution going to look like?